from being an abuser to then being in recovery, that transition, the first, let's say, weeks, months, maybe even years?
Well, I just went to recovery groups, and in retrospect, I really wish I had gone to treatment, because if I had, I would have had medical help, and that would have made the transition a lot easier. I basically detoxed myself and went through incredible physical and emotional anguish through that transition, and it lasted for about 18 months.
Wow.
And you know, this is part of why the recidivism is so high, because it is so difficult to go through early sobriety, because the body is going through so many physiological, psychological, emotional, and spiritual changes.
But wait a minute, you're making recovery sound scary. What I hear you say is that period is painful. The switch or the transition from being on drugs or alcohol to being sober. Are you really saying that?
I'm really saying it really is difficult, but it is nowhere near as painful as staying addicted. And it continues to get better all the time. Every single month, I asked myself, how am I doing? Am I feeling better than I did last month or last week? And I always was feeling better, and things were getting better all the time. But even with the medicines that are now available, such as buprenorphine or Suboxone, there is still some discomfort and some difficulty to go through that transition. And while it's not intolerable, it is a transition. And so people have to expect that, you know, it's not seamless.
And that period is going to be painful, physically painful, even for a week, 2 weeks,
it depends.
6 months?
It depends on where you started, how much you were doing, what you were doing, and how slowly you make that transition. In my case, I had 15 years of very heavy use, no medicines to help me through the transition, and so I was dealing with a lot of anxiety and you know, a lot of mood swings, but as I said, it continually improved, and that was enough to keep me going.
So your brain was healing itself with the withdrawal of the medication it had not the medication, the drugs that it had become used to. It had to adapt to not having those drugs in there. It had to heal and recover and find a new way of being. If you had taken medication, what would you have been given some tranquilizers to help with the anxiety?
Most certainly.
Okay, so what I'm hoping to put out there for people is that although the recovery period is painful initially, it can be softened by taking medications that reduce the anxiety. Remember, Dr. Gadhia-Smith did this on her own. So when you have the guidance of some psychiatrists or other physicians working with you on medication, although it's not a comfortable period, it may not be as difficult as hers was. Yes or no? Yes. Okay.
And with patients that I work with, I routinely refer them to psychiatric consultants for medication help. But you know, a lot of people opt to go into a treatment program, and that's part of a structured treatment program as well.
Yes.
So the more help you have, the easier it is.
You mentioned that you went into recovery groups or into a recovery group in order to help you through this. My sense is that these recovery groups are crucial in the recovery process. And I know when we've spoken before, you've confirmed that. Would you tell the audience why these groups are so important?
Well, the recovery groups really provide a variety of functions. One of the most important things is that the alcoholic or addict carries an enormous amount of shame. And being in a group with other people who have the same kinds of issues treats that shame as nothing else does. In addition to that, recovery groups provide a vehicle for self-regulation.
What do you mean by that?
Developing your own rhythms. It's like when you're a little child, you need to go and sit on mama's lap for emotional refueling. And you go and you sit on mama's lap and you get refueled, and then you can go back out into the world and play and have a good time. Then you get depleted and exhausted, and you need to go back and sit on mama's lap again. And as we get older, we get bigger, but we don't change all that much. We still need emotional refueling.
Comforting.
And the recovery groups provide that in a very healthy environment. And in addition to that, you develop a lot of social relationships. Isolation is one of the hallmarks of the disease of addiction. Isolation from others and also isolation from oneself. And so developing relationships is a very important part of the recovery process. Developing a cohesive sense of self, meaning just a sense of self that is unified. A lot of people, when they first come into recovery, and as I did, feel shattered. There was a book called A Million Little Pieces. Well, that's absolutely true. You do feel in some ways that the substance was the glue that held you together, and then when you get sober, there are all the pieces, and then they get put back together again through being in the groups, through sharing our stories, through hearing others' stories, identifying with those stories, learning how to live a step at a time, and most importantly, learning how to live in sobriety, because the work of recovery is much more about living than it is about just not using. And learning how to face day-to-day challenges. How do I go to work? How do I feed myself? How do I go to sleep without the help of a drug? How do I go on dates? How do I become intimate? These are all challenges that people face in sobriety.
Very important information. Also, you said something when we were talking before we began taping, that you talked about shame and you talked about applause.
Yes.
Okay, tell the audience what you were telling me.
Well, in the recovery groups, you can go in and talk about your darkest secrets and the things that you've been most ashamed about, and people applause and love you for it. And so by getting the acceptance from other people, you then can internalize it and develop self-acceptance. And the shame lifts, and you start to feel good about yourself, and you start to feel that whatever you've been through can in some way benefit someone else. And ultimately, that's what it's all about. And that's why I wrote From Addiction to Recovery, because I wanted to write something that would help other people. It is sort of an extension of my professional area of expertise. And, there are a lot of great academic books, but I personally felt that sharing my own experience would be far more valuable than another academic book.
And in writing the book, clearly, you were not or are not afraid of being labeled. You have incorporated where you were into who you are now, and you're self-accepting so that you're not afraid when you say, yes, I am an addict or a recovering addict or an alcoholic or a recovering alcoholic. You don't feel shame about that.